it's Leigh again, and thought I'd talk about the fibula here in the lower leg, the fibula. Now, doesn't it make you wonder why nature would make a fibula, like a non-weight-bearing bone? What would this bone be about? So one of the things that's so important to understand about this non-weight-bearing bone is that it has a lot of purposes, actually. Every one of the muscles and fascia that's connected from your hip on the same side, say we have a right leg here, from the right hip all the way through the right foot, every piece of muscle and fascia has some kind of direct or indirect connection to this fibula. The fibula is a bone that actually tensions and organizes how all those fascias and muscles work together. So, what else does a fibula do besides this organizing factor for the whole outside of the leg? It helps the way the position of the foot hits on the ground instead of that slapping motion. If the fibula is working correctly, the foot will gently go from heel to toe in a pattern based upon the fibula's ability to move. The other thing about the fibula is, when I take a step, what's supposed to happen is that my fibula is supposed to rise and rotate. And then when I release that part of my flexion of the step, my fibula is supposed to go back down and de-rotate, go back to neutral. So it has this action of twisting and pumping like this. What does that do for us? Well, there's membranes in between these bones here, the two bones, the tibia and the fibula. And what it does is creates a pumping action in between the bones that helps to pump up both lymphatic and blood back up the body. Because there is no other pumping system besides muscular and movement in order to make lymph and blood flow have its return. So that action of the fibula, that pumping action, will create the fluids to be pumped back up the body. Nature's pretty amazing, I think. The other thing is that every time I take a step, the bottom end of my fibula is supposed to widen in order to accommodate my foot. If it doesn't do that, you can see foot pronation, you can see things happening on the Achilles tendon. All those things will have to overwork in order to compensate for a fibula that's not working as well. So, just a few things and some ideas about the fibula and the body. It's a much bigger, more important bone than we ever realized. Thank you.